Hey, I'm Dr. Brett Raynor, orthopedic surgeon here at Texas Orthopedic Associates in Dallas, Texas. So in terms of preparing to have a rotator cuff surgery, the biggest thing is that you're going to be a little bit reliant on people after the surgery. There is never a fun time to have a rotator cuff surgery, and the reason for that is in order for that tendon to heal down to the bone, we have to protect it a little bit, especially for the first 6 weeks after an operation. So you're going to be in a sling for 6 weeks after that operation in most cases, which means driving and taking care of yourself and doing all those things that you take for granted on a daily basis all of a sudden become a little bit of a bigger chore. So arranging help after the operation is one of the biggest things you can do to maybe prepare yourself for what it's going to be like afterwards. The good thing about shoulder surgery is that you still have 2 good legs and 1 good arm to use to help yourself, but it's still going to require some help from other people. We also start physical therapy pretty soon after this operation. Sometimes for a really big tear, we will just lock you and not let you move this for even up to 6 weeks afterwards. But sometimes getting that physical therapy set up ahead of time can really help schedule that so that you can go ahead and start that in the immediate post-operative period if it's a tear pattern that is okay to start moving, and your surgeon will outline that for you after the operation. But setting up help is one of the biggest things you can do, and also just working on those muscles and working on flexibility leading into the surgery is going to make it so that it's a little bit more flexible afterwards.